PROs in ophthalmology trials can either be self-administered by the patient, or the responses can be collected through an interview administered by the investigator or site personnel. They both present advantages and disadvantages that can affect the responses provided by the patients. Self-administered PROs require less coordination, as patients may complete the questionnaires on their own time, and it allows for more patient autonomy. If you plan to include questionnaires that explore more sensitive topics, such as satisfaction or personal feelings, patients may feel that they have more privacy when completing a self-administered questionnaire and therefore be more comfortable. PROs may need to use the interview mode in some cases, especially because of potential visibility limitations within this group. Also, if the population skews more elderly, there may be additional dexterity limitations or technology difficulties. However, there are some important limitations with using an interview mode. There is an interview bias, which can impact the validity of the data. The presence of an interviewer can be distracting, and interviewers can vary in their ability to appear or sound neutral, listen, aid in recall, and record responses. This is why there needs to be a strict standardization of the interview process, and it typically requires additional training for the interviewers. Because interviews involve a social interaction, it can lead to respondents taking social norms into account when responding. This results in what we call social desirability bias, which can lead to over-reporting of desirable behaviors or under-reporting of undesirable behaviors. So for example, a patient may want to report that they have 100% compliance to the study drug when they're face-to-face with the physician, even if they had poor compliance, just to avoid disappointing them. Interviewers do have some advantages over self-administration, such as the interviewers can control the order of the questions being administered. They can redirect the respondents back to a topic of relevance. They can probe for more information and utilize a range of techniques to prompt memory. While in the self-administered setting, the respondent alone has to judge whether the information they have recalled is relevant to the question. Selecting the method of questionnaire administration should take into consideration the preferred method for the patient to encourage the most accurate responses, and how to reduce the potential biasing effects of each option.